We're back with Max Botticelli, President and CEO of University Health Alliance. I noticed that it seems like a large percentage of your members are located on the Big Island and on Maui.
Yeah, quite a few, yes.
So was that a strategy in marketing when UHA started?
We wanted to be on every island for sure, and some opportunities came up when we were able to obtain as customers 2 hotels on the Big Island, and that was helpful. So,
who got the sale or deal on that? I mean, did you go out and make the sales call?
No, I'm not much of a salesman, I'm afraid. No, we were. Our sales staff got in touch with those hotels, and we were able to get them as partners, and they've remained customers and partners ever since. Yeah.
So, what kind of advice would you give to medical practitioners, doctors especially, that may want to leave their practice and do something else in business, or may want to add an ancillary business onto what they're doing now?
I guess it's just a matter of expanding your view of medicine and how it should be practiced. And the one thing I think every physician should do is look at their own practice. Physicians in general are not the most effective business people, and they don't spend enough time looking at their own practices and becoming familiar with what an accountant does and what the billing process is and what the reimbursement process is with insurance companies, and so they don't spend enough time with that, and their practices become inefficient as a result of it. So it's a good school. It's good training.
You currently sit as a member on the board of directors of the Waikiki Health Center.
Yes.
So as a busy person, CEO, I mean, why are you involved in extracurricular to improve the community? Why do you do that?
Well, I'll tell you, we got involved sort of because one of the people that works for our company learned about what they were doing in Waikiki, especially with some of the young kids who were homeless and on the streets in Waikiki in their YO project. And he dragged me down there one day to take a look at it, and we were so impressed with what they were doing that we decided that we should give them a hand. So we made some contributions and bought them a refrigerator full of food and some other things. And this was 4 or 5 years ago, and then we continued on doing this. We thought it was a good place to focus some of our charitable work, and then they asked me to be on the board. So,
what do they do?
Well, they take care of uninsured people. Well, they take care of people whether they're insured or not, and they also have this YO project, which is directed towards homeless young people, and there are quite a few in Waikiki, and they provide them an opportunity for food. They can get a shower there. They can get some of the things that they should have. They also have a program for elderly people in Waikiki. They get volunteers to go and be friends to the elderly who live in Waikiki, and they also have a outreach program that covers virtually the whole island, and with healthcare as well as public health aid to people who are not getting that sort of care right now.
Thanks for tuning in. Stay tuned for more on Greater Good Radio.